Hello.
I would like to call Mr. Damon Wolf.
Yep.
Is that your name?
Yes. Hi. I'm a teacher at GW, and I'm going to consolidate my questions to keep this kind of speedy. My question is regarding the number of chronic medical conditions plaguing Guam, such as obesity, diabetes, high blood pressure. What measures do you plan to take to help reverse these trends? And to go on off of that, would you support taxes on tobacco, alcohol, food chains, and sugary drinks that's available to the public?
That would be you, Senator.
That's 2 points. I'm not in favor of any new taxes or any increase in taxes. I gotta confess, you're right. I made Pepsi. But at the same time I was making Pepsi, my opponent was making Hanum Taki when he was controlling TWA. I'd rather drink Pepsi than Hanum Taki. What we will do, and is most important, is not praising the burden and not allowing you people not to have choices. It's investing in education. As Ways and Means Chair, I invested in education, mental health, and public health. Programs that deal with funding wellness, funding good habits for our young people. I was the biggest proponent in the private sector and the public sector for more athletics, football fields, gymnasiums, baseball fields. I did it in the private sector, and I continue to do it in the public sector, working with our mayors not only in improving our gyms and our fields, but working also in cultural exercises. I would like to have our police department not only deterring crime, I want our police officers working with the mayors and being coaches, being mentors, so that we have many of our young people seeing those police officers as not as the enemy, but as role models. We're going to build a good, healthy lifestyle, but it starts with education. My priority. Thank you.
Mr. Gutierrez.
You know, there's a young lady, maybe not so young, but young lady, at the Department of Public Health. Her name, Dr. Anita David. You know her? She's the medical director there. We got to draw on her expertise. She was with the World Health Organization. We've got to make sure that we don't have to just keep looking at taxes to change our lifestyle, because she said it doesn't work that way. Usually you need to wean people away when they have a bad habit. But we need someone that can pull together the community under Vision 2020, figure out what it is that we need to do to be able to get the right situation going here in Guam, so that we don't smoke, we don't drink as much, and we don't drink too much Pepsi. Ladies and gentlemen, I said that because you brought up Pepsi. We don't need taxes to be able to try to punish people that do smoke. We got to give them a climate of agreement so that they can wean themselves away from smoking. You don't say, what they'll do, you probably end up stealing or whatever has to be done, because they're used to smoking. Don't make it difficult, but let's change their lifestyle. By Dr. David, that's Dr. Rubio's wife, I believe, she's a lucky man. We've got to be able to bring back the people's thinking that healthy lifestyles has got to be done.
It's always interesting when I listen to the debates, and especially from Carl Gutierrez and Frank Aguon, when they talk about not wanting to raise taxes. When the last State of the Address from Carl Gutierrez, he asked to raise the GRT, and when Frank Aguon took over in the 27th legislature, he actually did raise GRT, which hurt our people, which hurt all of our island. And ladies and gentlemen, in the Calvo-Tenorio administration, we don't intend on raising taxes. We want to make sure that our people can afford to do what they need to do, but we don't need to raise it as Frank Uggan did in the 27th legislature when he needed more money for this government. We need to make sure we tighten our belts. We need to make sure we do educational programs. We need to make sure that we work with the rest of our community, because the answer to some of the problems in our community with healthcare are not taxation. We have increased the taxes on certain things, but we need to be intelligent about it, because sometimes when you increase taxes, and as my good friend Frank Uggan has learned, it's not the right thing to do. Thank you.
You know what's very interesting is that my colleague was in the 27th Guam legislature when in fact those taxes, the GRTs, were adjusted. You know, in the private sector, immediately after Super Typhoon Pongsawan, ladies and gentlemen, the income for the government of Guam dropped significantly. We know because over 2,700 employees were released in the private sector. One of the things that Governor Camacho at that point in time said, if we don't adjust and increase revenues for this government of Guam, and that idea came from him, then we're going to have to release 2,500 to 3,500 employees within the government of Guam. The legislature was not ready to release public employees when in fact we already have 2,500 private sector employees who had to go. Many of them were going to public health to be able to receive support so that they can provide food on the table. Ladies and gentlemen, sometimes when you're a leader you have to make tough decisions. But after, I need to say that after we realized that the revenues had leveled off, guess what? The legislature, with the assistance of the majority, because it wasn't me, but the legislature stepped back in and said, Governor Camacho, we're going to live in with a tight budget. We're going to rescind the GRT 1 year earlier than it was implemented because we can live within the budget. And those are tough decisions that have to be made. Let me also say this in direct response to the question. You know, when you look at preventive care, when you look at fitness, that was part of legislation that I had introduced in this legislature to make sure that we start changing the lifestyles and the thoughts of our people. Guess what? Every dollar spent in preventive care can save $7 that we spend at any of our public facilities, and that's money worth saving and rediverting toward prioritizing at GMA.
Thank you, Senators. Thank you. Our next